It was something I had never heard of before. So they did the initial interview and I did the initial treatment. It was like, wow, I actually felt something the very first time I came here. And so I continued. It was something I talked over with my family and we decided, let's go for it. The way I was living was no way to live. It was definitely the turning point for me. It's what, if I would have heard, or if I had never heard of the table, I had never heard of that stretch, how to decompress that way. It was something I was so frustrated with the traditional therapies I was doing because none of it was working. And all that was just a Band-Aid on something that wasn't gonna help cure or get me better. It was just gonna cover it. So it was like, well, how long is it gonna cover it? Well, as long as you need it. So theoretically, I could be on this medication forever. And it's like, well, yep, we'll continue to prescribe it for you. And it's like, what about all the consequences to that medicine? Like, well, no, but the long term, good for me. It was surgery. And I was trying to avoid the surgery because, surgery, it does help or you come out worse than you were before the surgery. And I had not heard of this type of therapy, but after that first trial run, it was wonderful. I felt it. I felt my legs, the feeling came back to normal in my legs, and it was like, I hadn't felt that in 8-9 months. So it was wonderful. I had one single treatment. I wasn't promised that. I wasn't told, hey, this is the selling point. After one treatment, you're gonna, no, it was just, this is what we have to offer. This is what it is, go through it. That way you feel it. And it was like, wow, it felt amazing. I could see where, hey, if I continue this, it will definitely decompress my spine, and which in theory, it's going to heal me. And it's like, wow, nobody's talked about healing. Everybody's talked about, well, we can do this, this, and this, pain, Band-Aids, and just, we'll up the medication, we'll up this. I don't know the specific of when I started. I asked the doctor if it was hereditary or if it was through trauma, and he believed it was through trauma because of the locations that they're at and the degree of which they're at. I played college football for a couple of years, so I'm sure it had something to do with that, because there's plenty of times where I think I forgot my helmet, I still played, and so I'm sure I did some injuries to my back and my knees and stuff, and I tore my Achilles tendon a couple of times, so I knew I walked different, I knew I had to compensate for it, and I'm sure my back carried most of that load when I would lift weights and stuff. Oh, deadlifts were, key, and you always try to lift, 3 times your weight in deadlifts, twice in squats, and there were times where, you'd load the bar with 500 pounds and being that back then at 200 pounds or 195 pounds, it's a lot of weight. I hurt a couple of times literally my back cracking. But you're young, so you bounce, throw a little dirt on it and you bounce and keep going. And it's what you wanted to do. But you think, well, if I lift more weight, I'll get bigger, I'll get stronger. I can hang with those big guys and but at what cost? And of course, now I know the cost. That was an expensive bill. I don't recommend on anybody. I do believe we all have a certain amount of life in our joints and our muscles and bones, and the more athletic you are, the sooner you're diminishing that capacity. You're using it up, using those reps up. So later on, when you think maybe I could have used those reps, you don't have them in store. Later on, as I get older, all that stuff starts resurfacing, and I would get flare-ups, and I always thought it was my sciatic. So I had always, just medicated and tried to stretch it more, and it would subside, but then it'd always come back like in 4 or 5 months, 6 months. And as I got older, it just lasted longer. So this last time, it was totally, it lasted for 8 months, did not go away, 9 months. Well, what I thought was sciatic pain was really the discs, the herniations, but my right leg was almost completely numb. I would drag it when I would walk. My left leg up to my knees, to my thighs, I kept feeling like a million pins. So it was painful to walk. It was painful to stand. It was painful to sleep. No matter what position, if I tried sleeping on my side, tried sleeping on my back, I just couldn't do it. Everything hurt. It was affecting my personal life with my wife and family. It was affecting my work because I'm irritable. Nothing is pleasing anymore. Going for a walk hurts. Going to sit down at a restaurant where it hurts to be in an uncomfortable chair. It was just ruining my life. So I was short of the surgery, which was the next step, because I had tried masking it with pain meds, doing the shot injections in my spinal column. I had 3 of them. Nothing was working long term. I didn't want surgery, so my wife luckily found this place. We did the test drive here, and I felt wonderful after the very first session. Discussed it with my family, and because the treatment was going to be over vacation. Over the summer, my daughter's in college and she was home for the summer, and my wife is, vacation for the summer, and we gave that up. My wife is, oh, that's a great thing to give up on your part because you're miserable, I was making her life miserable. I was making my daughter's life miserable because I'm in pain. And they'd say, hey, let's go let's go walk, let's go bike ride. And it's like, do you know how much a bike ride hurts me? I can't do it. And they're like, you're already acting like you're 100. And it's like, well, I'm in pain. And of course, we'll take some pain meds. Well, all they do is make you sleepy and want to sleep. And so you're kind of rendered at home useless. And luckily, my wife found this place. I tried it. I'd never heard of this kind of bed therapy, the stretching decompression. It was wonderful. From the very first time I tried it, I could feel relief in my legs. I could feel relief in my back. So it was an easy decision after that test drive. It was a constant 8, 9, 10. Constant. During the day, no matter what I would do. Again, no matter how much I stretched or tried to decompress on my own, and the therapies and the medication, every waking hour I was in pain. We have a lazy boy at home, and I would try sleeping in that with my legs up, almost all the way back, and, whatever position, lying on my side, lying on my back, everything was painful. Of course, the more pain medications I would take to compensate for that pain. Of course, at work, I was showing up the next day foggy, groggy. Some days I didn't even want to drive because I knew I was still under the influence of the pain meds, and because all the doctor would do was just give me stronger pain meds, and I knew that was no long-term solution.
You mentioned how interesting it was that we were treating different disc levels. So there's other clinics that say they offer decompression, and it's not. The difference is with DRX, we can isolate the disc level. And I felt that.
Dr. Hoffman was very meticulous about that. When it first started off, I would believe he was addressing my lower disc. Mm-hmm. And we tried that therapy for a couple of weeks and received wonderful results. Then we started focusing on the top one, and then we went back down to the bottom. So it was tailored for me. It was not a generic table, hey, here's the angle, here's the weight. It was to my weight, where my problem areas were, and it was a constant readjustment and evaluation. So that route was tailored for me, and that's the part of the reason why I love this treatment so much.
What's interesting about the DRX is we're isolating where your problem is. We have 5 lumbar discs, and each one of them are in a different location. We treat one area or one disc level, and you see a lot of relief. Sometimes when we change it to a different disc level, you may not have pain coming from a different disc level. But we want to try to hit all the major issues in your spine so that you get some benefit at each one of those levels. So with your disc levels here, you've got spinal stenosis being caused from a disc herniation, and then some narrowing of the back part of your spinal canal due to a little bit of arthritic change in the bone itself. Your disc has a tear in it right here.
But that's what makes it so, I guess, healing, was that it is individually tailored to what's wrong with me. But this is a lot less invasive, of course, and hopefully just as productive because it has taken it away. So I would 10 times recommend this as opposed to go in there and cut me open and see what you can do.
It's scary. There's not a patient out there who is having serious back issues that has been told, hey, you might need spine surgery. There's not a single patient who's thought, oh my God, that sounds terrifying.
It is. It is. And it was brought to my attention that was probably the next step. And I was trying to avoid that at all costs. And that's why I'm so grateful and thankful that I found this place, and it's well worth it.
Yeah.
When I saw the relief after the very first treatment, and then the individual tailored results to fix me, it's definitely worth it.
Yeah.
Definitely worth it.